Well, thank you, Madam Chair and Ranking Member and members of the committee. And happy end of week 4. I think we're on week 4, so we're trucking along. So, and again, thank you for hearing this bill. I really appreciate it. And this bill has been around in some form or another for quite a while. But we have a serious issue, and I will guarantee, will bet that each and every one of you have heard from your hospitals, your nurses, your medical community about the crisis in the staffing of nursing in Washington State. And it's beyond Washington State. It's really a national problem. And so we need to do whatever we can to help incentivize and fill those needs in our communities, in our hospitals, in our medical facilities. And I want to be clear, this bill is not in isolation the answer. There's no single answer. There's no single bill that's going to solve this problem. This is part of a broader solution and a broader discussion. There's currently discussions going on about pay, about working conditions, about staffing levels, and all of those are important component pieces. So not one of those will solve this problem. This bill will not by itself solve the problem, but it would be a powerful tool in bringing nurses into Washington State because it's a great state to live. And as you heard from staff's briefing, there's 39 states that are part of this compact, which gives a great deal of mobility. And also the individual states still retain control over oversight and regulation and review of their nursing professionals. So I think this is would be a very effective tool for doing that. And just, you know, we all have different districts in different areas of the state, but we live in a border community in the 6th District in Spokane County. Oh, by the way, for the record, I'm Mike Volz, 6th District Representative. It's Friday, it's early. Anyway, but we live in a border community, and we see a lot of action between Idaho, the Coeur d'Alene area, Kootenai County, and Spokane County, and we see a lot of nurses, and I've heard from nurses, I've heard from the hospitals, both in Washington and outside of Washington, talking about this issue, and would like the compact and the flexibility to work in Washington if they're working in Idaho. We've lost nurses, and I know some personally, that chose to work in Idaho for a variety of reasons and leaving their jobs in Washington for a variety of reasons. So I think this bill is a good component. I think it's an important component to join this compact and give us flexibility and flexibility to our nurses and nursing staff in our hospitals in supporting our communities and our citizens. And just for the right, so I'm a CPA. I'm not a practicing. I don't do taxes. Some people claim, in my case, CPA stands for can't pay attention, but that's maybe a discussion for a different day. But anyway, my license is regulated by a national board, but there's also a board of accountancy in Washington State, and my license is fairly mobile. It doesn't take extraordinary effort to transfer my license either from Washington State or to Washington State, and I believe that's true in many other licenses. I've heard from doctors and nurses alike that in some cases, having your doctor's license transferred into Washington State is easier than having your nurse's license transferred into Washington State. And so I think we should do whatever we can to maximize the flexibility, to support our communities, to bring nurses in, because I'll tell you what, Washington's a great state to live and raise your families, and we need to do, I think we would have a lot of nurses in these compact states wanting to come to Washington and live in our communities and live in our state. So with that, you know, have any questions? I know you guys got a full docket today, so if you don't want to ask questions now, you know where to find me, and I'm hard to miss in a crowd. So,
thank you, Representative Volz. We do have a question from Rep. Levitt.
Thank you, Representative, for bringing this forward. Really appreciate it. And you just mentioned that it's easier for a doctor to get a license in Washington State than a nurse. And this question may be for Jim. We have a physicians compact in Washington, correct? And maybe that's the reason having that compact for physicians has made it easier for them to transfer Might you agree?
I do agree, and also I forgot to point something out. You and I share something in common. We have military bases in our district, and that has, I've heard from the folks from your base and certainly from the folks from Fairchild at my base about the importance of that compact and other compacts, and particularly regarding nurses, where they come in for a 2 or 3 year rotation and they don't really have time to transfer their nursing license to Washington State. So I think, I'm sure you have heard from your folks, and I've heard from them, and I've heard from folks on our military bases. So I think that's another consideration. That's Washington State does have a large military population, and I think these compacts and licensures across a broad spectrum of professions really support our military communities and our military families.
Thank you. I don't see any further questions, and I just want to say that we are hearing this bill because we recognize your points about workforce and the challenges that we have right now in our healthcare workforce. It seems that this bill has come forward a couple times and has struggled a little bit, and I'm assuming that you're working with stakeholders on this and other concerns that we may hear in our testimony.
Oh yes, yes. Thank you for that question, Madam Chair. Yeah, absolutely. I'm under no delusions that this bill is perfected right now, and that there are a number of stakeholders. I'm willing to work with anybody to bring forth and perfect this bill. I should have mentioned that up front. This isn't perfect, and it's not the only answer to the only solution to this problem. So whatever we need to do, I'm not all knowing about this stuff. So whatever we need to do to get this going and keep it moving, I would appreciate working with, like I said, anybody, any stakeholder, anybody on the committee, anybody in this body.
Thank you. I bring it up only because this has not come in front of the healthcare. It's come in front of the healthcare committee and not in front of our committee, which is looking at credential, higher education, as well as workforce. So for us, it's instructive to understand kind of what those connections and those conversations are.
Yes.
So thank you very much for staying engaged, and really appreciate you having here. I know you have an executive session to go to as well, so let you go. And anyone who has further questions for Rep. Volz, please reach out to him.